Hello, everyone. Good morning. Welcome to this Fertifa webinar. We'll be starting in a couple of minutes. We're super happy to have you here. It's 9:58 on my clock. I can see the participants number ticking up, so I'm going to give it a few minutes, but I also want to respect your time. We're very excited, Sophie and I, to talk to you today about a topic that's close to our heart, why parents leave and how to drive retention in their first year back to work. So we'll give everyone a minute to turn their fans on or get a glass of water, whatever you need to get through the hot weather, and we'll get going. It is now 10 a.m. I can see the participants number is still ticking up. So I'm going to give it about 30 seconds and start with some introductions. It's, I can see it's going quite fast now, so I will give it a few seconds. So you are with Celine and Sophie today for the Fertifa webinar discussing parents returning from parental leave, how to retain parents, and how to drive retention, the practicalities around that. So I will start with just a few housekeeping points whilst people get settled. Firstly, we're very happy to have you here. As you're, I'm sure, accustomed to, this webinar is recorded. So a kind reminder from our side not to share any identifiable information. You can use the Q&A box anonymously if you tick the anonymous little box, or you can talk to us in the chat directly to the panelists if you have any questions. So just a reminder on that. This webinar is recorded and will be forwarded to you in case you have to leave for any reason or you can't make it or you're watching later. That is not a problem at all. I do get this question a lot when we are presenting for people who join a bit later. People are still joining, but I'm going to start with an introduction about Fertifa. In case you're new to Fertifa, we're Europe's most comprehensive well-being provider. We work with enterprise companies, SMEs to create more inclusive workspaces, and we support employees globally with many different pathways from family forming, menopause, men's health, women's health, most recently mental well-being, lifestyle health, as well as neurodiversity. But today's topic is very close to our hearts because we're not only here as Fertifa, I guess, employees talking to you about this topic, but we're also here as returning parents who have been on maternity leave and have had children. So hopefully we'll keep it very professional, but we might intersperse it with a few personal anecdotes from our experience, won't we, Sophie? So I'll lead with the intro and then I will pass over to Sophie. So I'm Celine Crawford. I'll be your co-host for the next 40 minutes. As the director of people at Fertifa, I'm joining, as I said, wearing two hats. I'm a chief people officer professionally. My passion is scaling organizations, and I'm very, very passionate about women's health and well-being in the workplace. I've gone through my own fertility journey, specifically with pregnancy loss, and as I said, I've returned twice to work. So I have a lot to say on this topic, and hopefully it gives me a unique perspective. Thank you so much, Sophie, for joining me today. Will you introduce yourself, please?
Of course. Thank you, Celine. So my name is Sophie. I am one of the senior midwives here at Fertifa. I've been a midwife for over 10 years now. And yeah, I've recently, just at the start of this year, returned from my own maternity leave. My little one is 18 months old now. I'm massively into patients being able to advocate for themselves within healthcare settings, and that's one of the things I'm really passionate about. But what we try to achieve kind of on the clinical team here at Fertifa is how they can advocate for themselves within the workplace as well, and all aspects of kind of their care and lifestyle. So yeah, I'm really excited to talk about this topic. It's so important, and just want to say thank you for everyone joining us so far.
Yes, really, thank you. Because you could be anywhere. It's summer holidays for some people. You could be joining any webinars. You can be doing any meetings. And so we're very, very privileged that you chose to spend some time with us today, and hopefully it'll be worthwhile. So if you go to the next slide, Sophie, I'd like to just share the intention for today's session, mainly to discuss what is the current landscape facing parents today once they return to work after having a baby. And when we talk about parents, we talk about all modern forms of family, whether single parents, same-sex parents, heterosexual couples, whatever that is. We'll then move on to the core drivers of attrition. So what are making parents leave? We'll talk about the parenthood penalty, including the gender and patient pay gaps, which is quite an important topic in my opinion. And then we always like to end on practicalities. So if you left this webinar today, what are some of the things that you could do to drive retention and support returning parents? We'll talk from everything from the most simple and I guess basic 101 stuff to, the deepest level of support that you could offer. But before we do that, we do love data at Fertifa. And so we are going to start with a few polls, if that's okay. I'm going to launch that now. There are three questions. And if you don't mind, um, I would really appreciate if you answered them. So the first question is, when do you see the highest risk to retention among new parents? Which we would love you to answer if you know. You might not be tracking it, but if you do, please let us know. The second question is, how confident are you in your line manager's ability to support returning parents through that transition back to work? We'll talk a lot about how managers have a significant impact on people returning back. And last but not least, where does improving working parent retention sit on your strategic agenda over the next 12 months? So we have about 33% who are answering. We're close to 50% now. So I'll let it track for a little bit and then I'll share the poll with everyone. I can see, I'll just give it a few more seconds so we have more comprehensive data. We're at 60%. Thank you so much for sharing your insights with us. Okay, we're holding at 72%. So I'll go ahead and share. In terms of the highest risk of retention, I think almost half of people today are not currently tracking it. So I think that'll be interesting to discuss if you did want to, as to what the right metrics would be to track. Next, we have 30% see the highest risk 1 to 6 months, and then 9 and 20% for the other two. How confident are you in your line manager's ability? A very high percentage is moderately confident, so 63%. So depending on the individual manager, and we'll talk a bit about the manager lottery, so to speak. We have 22% with low confidence, which is an interesting point. And in terms of the strategy for your business over the next 12 months, it's on the radar, but not currently prioritized or funded, 27%. Important, but competing with other initiatives. We hear that a lot, 41%. So that's the highest. And then the split for the last two. So thank you so much for that. I'm sharing the results quickly so you can have a look and scroll through. But we'll get going. So we'll keep an eye on the chat. And we also will keep an eye on the Q&A box, but we like to keep it as organic as possible. The session is being recorded and will be forwarded to you in case you miss it. So let's begin, Sophie. When we talk about, I guess, a pain point or a topic, we like to set the current landscape for parents, and these stats speak for themselves. So, shall we start going through them?
Yeah, absolutely. So I think although kind of statistics are useful, we can apply them. It's actually thinking about kind of the people as individuals as well, and kind of why the reasons are these statistics exist, and what is it that's causing kind of 1 in 10 mothers to kind of change employer. Is it because there's so many different factors? And I think that's what we want to kind of address today, is that not all of those mothers that change or leave, or kind of all those parents that leave, will leave for the same reasons, and that can be quite a lot to kind of manage as a company, as a manager. But I think it's important to understand that it is multifactorial, and just by kind of having an appreciation, people feeling seen, it will hopefully help to reduce that number. But 1 in 10 is quite a large percentage of employees that potentially either leaving work altogether or changing employer. Based on kind of how that transition is back to work. So anything that we can do to improve that number is going to be positive. And it's thought that 1 in 3 are kind of leaving a job because they're not being supported as working parents. And again, there's different ways that people can be supported when returning from parental leave. It for not everyone, it's actually about the job itself. It could be outside kind of factors that are kind of influencing that support they feel, whether it's that work-life balance, whether it's kind of understanding of kind of both the physical and emotional kind of recovery post-birth, whether it's an appreciation about kind of timings and shared priorities. You've got to think about, we've got childcare, you've got people calling you to say, come and pick up your child from nursery or childcare because they've got another bug. We've all parents probably have been through that. And it's that then kind of, if you don't feel supported, that you can do that and then kind of make adjustments to your working schedule. Then kind of, there's so many reasons. It may not actually just be in the job role itself that people are feeling that lack of support. It says 6 in 10 parents report feeling exhausted in 12 months after having a baby. I would probably argue that could be higher. I definitely know I felt a
Great.
constant state of exhaustion for that first 12 months, and still do even 18 months later. But it's about what that knock-on effect then feels like. How does that reflect in kind of day-to-day working? What are their ways to kind of help with that? And knowing that every day might be different. It might be that they got no sleep the night before, so they're completely exhausted, but another day is absolutely fine. So it's just a constantly changing thing as people adapt to coming back to work and adapt to this stage of parenthood as well. And
Sorry,
it's all,
somebody wrote something hilarious in the chat, and I have to share it because we said 6 in 10 report
yeah.
feeling exhausted, and so I love this. I'm going to use it forever. This person said 4 in 10 were too exhausted to fill out the survey. So absolutely love this comment. Keep it coming. Yeah, sorry to interrupt you.
Absolutely.
Sorry.
No, please. No, I think that's a good point. I think, yeah, I think we can all agree on that. And then, yeah, 3 in 4 mothers can experience pregnancy or maternity discrimination, and that can come in so many different forms as well. In previous roles, I have had colleagues that have experienced this discrimination, and I've heard from kind of friends, family members who have experienced that. So that again, that number is high. 3 in 4 is a large percentage of people going on parental leave. Um, and it's about what can we do, and what can we understand that might be discrimination, but we're not aware that it could be discriminating against parents.
Yeah. We'll go
Yeah,
into the details as to what constitutes
yeah,
discrimination because there's quite a few things here.
yeah, yeah, absolutely.
Yes,
So yeah,
this really sets the scene, and I
yeah,
think a lot of people can really. And I think what's important to note is that, parents returning, they're not less ambitious, they're not looking to work less, they're not wanting to do less, but they just want to have the right support to be able to perform the way that they'd like to. And I think that's really important to say here.
yeah, absolutely, absolutely.
Okay, so on the next slide, we're going to go through the core drivers of attrition. So why are parents leaving? We've broken this down into 5 categories. And the first and very significant one is really managers and culture. So 76% of outcomes depend on the individual line manager. So that's what we were saying about the manager lottery. You can have a very empathetic manager who will give you flexibility, who maybe is a parent themselves, who understands, gives you support. And you can have someone who's very inflexible and will not give you support and does not have the empathy required to help you set the structures so that you can do your role to the best of your abilities. So I think that is very, very important. And we will talk later on in terms of what practical tools can we give managers to be able to support. Because, people are not experts, right? And there's a lot of expectation on managers these days to know about everything. So also let's have a bit of empathy for that by giving them the support. I think the second one is so important. And I mean, I've personally felt this in many previous jobs, and it's the lack of flexibility. So we say here that more than 1 in 10 parents who request a flexible working arrangement to support their childcare needs are denied. Um, and I wonder how much this number is accurate, given it doesn't really take into account people who don't ask for flexibility because they know that it's not going to be accepted anyway, or they don't feel like they're allowed to. So I think the flexibility remains a major friction point, and it's driving active exit. We also see, as we mentioned earlier, in terms of experiences and discrimination, that more than 1 in 3 who face discrimination will quit their job. And childcare costs break even. Nearly 1 in 3 parents state that it does not make financial sense to work due to the cost of childcare. I mean, that is a very, very tricky one because childcare costs in the UK, although better than some other countries, are still astronomical, if you ask me. And I know, Sophie, you have also some insights on that.
Yeah, so it's actually, I did some reading the other day about the new kind of funded childcare scheme that came in. I think it was the end of 2024 and kind of then was implemented the end of 2025. And it's where there's an increased funding, which is amazing. So, kind of, there's funding from kind of after a child turns 9 months old, there's kind of 30 hours of funding available for childcare. However, because of the criteria of this funding, I have friends, I have family members, of colleagues that have had to then adjust when they go back to work based on the eligibility on this childcare cost. Whereas for some people, it means that their baby gets access to that childcare quite early after they turn 9 months, which means their kind of return to work is quite flexible, can stay on track. Whereas for other people, they may not be actually eligible until the term afterwards, which could be after they turn 1 years old. And so that might then mean that they can't afford the childcare before those funded hours. So they're having to delay their return to work if they're already nervous about that. Or for other people, they may lose their spot of the funded childcare if they don't take it the term that it starts. So they may then actually, because it's not all funded, you're still going to have to pay that top-up fee. You can't afford to pay that if you're not back at work, not returned from parental leave. So it's even though those are kind of beneficial things, they still have an influence on kind of when someone may return and whether they're ready or not as well.
Yeah. And to add to that, there's also this calculation and maths, when you're going back to work to decide, are you earning enough to justify going back to work? And that is also the point where you lose a lot of,
Yeah,
unfortunately, women because they're the
yeah,
ones that tend to end up staying at home to just do the childcare and sacrifice. And some people choose to do that, so that's absolutely
yeah,
fine. But we're talking here about the people who would have rather continued working, but because of the cost, it's just not tenable.
yeah,
And last but certainly not least, burnout and mental exhaustion. More than half of parents feel mentally exhausted or burned out. I heard one of my colleagues say the other day, and she doesn't have children, and she was saying, I read that on average, parents only get 5 hours of sleep. And I was thinking, 5 hours, that's amazing. It just made me laugh. But yeah, so 53% also report increased levels of anxiety and stress. I mean, I know that I definitely had postnatal anxiety without knowing I had postnatal anxiety after my first child. But yeah, that's where information and support and awareness comes in. But Sophie, you speak to parents all the time, because you're also working
yeah.
on maternity and
Yeah.
returning in an infant care pathway. What do you see when you speak to families?
I think it's like it's such an adjustment period. So like the mental load is really high. And actually, so for some people, it might not actually be the job role and the kind of what they're returning to. It might be just everything else outside of that, and that can just cause that burnout. And it's the when do you get all the other jobs done? When do you maintain kind of your relationships, that work-life balance, and also the mental exhaustion around your child is in like when do you get to spend time with them? If you've gone back to work full-time, part-time, that like your time with them is potentially halved. And if they're in childcare, like I think it's there's so many factors that can
Yeah.
lead to that burnout that it doesn't even necessarily mean just the kind of job role. For some people, they can go straight back and they're thrown in the deep end and there's no kind of transition period, and then that kind of adds to everything else outside of it. Or it's kind of worried about people's opinions, expectations on return, and feeling that they have to be exactly where they were when they left, but they're a completely different person now.
Yeah, yeah.
um,
I mean, there's definitely a lot of guilt because you feel you're not doing any of the
yeah,
things quite
yeah,
well.
yeah.
And, it's actually in the first time in our generation that, we have 1 in 4 people who are in the sandwich generation. So maybe we'll have just had a child, but also are caring, for aging parents, or as you said, the mental load is not just the returning to work. So it does have a significant compound effect. And we will talk about it clinically in more detail.
Yeah, absolutely.
So, on to the next slide, we're trying to think about, you know, what does this do in terms of the effect over time? Because, when there's a pay gap, when there's a pension gap that gets created, it doesn't happen, in one go. It's kind of the cumulative effect. And we are diving deeper here into why this happens. So, first of all, there's a caregiving disparity. So we know that women are 12 times more likely than men to take career breaks specifically to raise children. And going back to the caregiving about the sandwich generation, in fact, women make up a large percentage of that caring community as well. So that is a lot to have to, think about. Secondly, there are missed opportunities, which mean that 1/3 of employers assume women returning to work are less interested in career progression. I think this is such an interesting one, and I can speak from personal experience because there is no malice necessarily behind the missed opportunities. I remember having a coffee in a previous job with the CEO, just catching up, and they were saying that, oh, we're hiring for this particular role, etc. And so I said to them, oh, but I would have liked to be considered for this particular role. And he was like, oh, really? But you're on leave. And I'm like, yes, but I would have liked to know so I could put my hand up, and that's my decision to make, right? Eventually, I did apply for the role, I did get the role. And so it wasn't a missed opportunity, but it could have easily been if we hadn't had that coffee, right? And I know my CEO is a very kind and supportive person, but it just hadn't crossed their mind that I might be interested. So I think it's really important to remember to keep in touch and not have those missed opportunities. So that compounds again the gender and pension pay gap. So thank you for allowing me to, to share my little story. Um, the third one is career restructuring. So 66% of women who were working full-time before motherhood reduced their hours after they had become mothers. And again, there's definitely women who do that intentionally, and I think that's great. But I think here we're talking about people who would have rather worked full time but are not able to because of the structure of their work. And last but not least, the pension pay gap. So a mother taking a 5-year career break at age 35 accumulates 69,380 less in total pension wealth by age 67, which is very significant. I had another stat here as well. A 30-year-old who misses just 1 year of pension contributions could be 45K worse off by 65. And you don't really appreciate the trade-off at the time because you're not really thinking about those things. And so there's really a lack of information. And we'd love to talk about how can we keep that conversation going so that women, are more aware, and parents, not just women, and can plan for their time away, and help to plan proactively. So what we're trying to say here is, the penalty doesn't begin on the day someone returns. It's the moments in between, because businesses tend to focus on departure and return and might be missing what's happening during the physical recovery, the financial shift. And it's really, really worthwhile to have those conversations and to arm people with the tools to be able to weather those gaps. I took quite a lot. Did you want to add anything here?
No, I think the pension one is a really interesting one because I think, like you say, it's not on a lot of people's radars. And I know, like, say for me personally, I was like, right, I'm gonna save some money to allow for kind of parental leave and kind of what that looks like to allow the time off that I needed and make sure that things were covered, like all those kind of things. But you don't then do that planning and saving for other kind of lost money and things like that. So I think it didn't even kind of cross my mind, and I think it's a conversation that just needs to kind of raise the awareness. And some people even stop all pension contributions during maternity leave as well. So even though pension contributions drop when on maternity pay, like if you stop them all together, then that has an increase. And I think it's about like, what does that calculation look like in the future?
Yeah,
Just
yeah,
opening that
absolutely.
conversation.
No, that's super important. And someone has asked me what I mean by the sandwich generation. And I mean people who have children, but also are caring for their parents. And so they have caring responsibilities either side. And so they're a sandwich essentially. And this is not the webinar for it, but in terms of the gender pension gap, there's also menopause that then kicks in, later in life. And that also adds to the gender pension gap. So if we can start the education and the awareness early on, then that helps later on as well.
Yeah, absolutely. Right. Should we head to the next?
Okay, yeah. So on the next slide, obviously, we're trying to talk maybe more clinically, physiologically, mentally, what happens with parents. And so that's definitely your area of expertise, Sophie.
Yeah, absolutely. So like I said before, it's about understanding that it's kind of there's multiple factors that can kind of play into people's hesitancy, anxiety, reluctance about returning to work, or kind of impact how they feel when they have returned to work. One of the most important topics, I think, is mental health and understanding what postpartum mental health can look like, but also mental health for partners as well. So this isn't maybe just about the returning parent. It can be about the person that is supporting a returning parent or the parent that is going through all the same things, but also working whilst their partner has been off. I think that topic isn't spoken about is the kind of postnatal depression and anxiety on kind of the non-birthing partner and parent. So I think it's just having that awareness as well about your employees. And with a lot of things, it's actually about how do you support that other parent as well, because then that increases retention across the board. So 84% of returning mothers will kind of experience that working parent guilt. And I think that can be both sides. So for me, I felt the guilt that I wanted to return to work. And I think a lot of people feel the guilt that they don't want to, they don't want to kind of leave their child after being with them for X amount of time. I felt the guilt that I wanted to return to work. And it didn't mean that I didn't love him, didn't want to spend time with him, but actually like I liked that balance. So it can be both sides, and it's understanding that some people want to come back and they really like are ready to kind of get back into their career, whereas other people are that reluctant. So it's about understanding the employee as an individual. And the identity conflict is such a massive thing because you do go through a whole identity shift. Even if you try and prepare yourself that you're not going to, you're going to stay exactly as you are, it still just does happen and nothing can prepare you until you go through it. So it's just kind of, you might feel like you're having to get to know a new person when they return to work, and they may have a different way of working, they may have a different communication style, they may. So it's just about getting to know them. And I think that's where potentially kit shifts can really help. I felt like that really supported me getting back into it and understanding my way of working and how that then looks going forward.
Yeah, I think that's so important, and we can talk about that in more detail as to
Yeah.
how much to stay in touch with the employee
Yeah.
before, during, and after, and obviously give the optionality to the person who's leaving. But
Yeah.
the kid days, especially if you think these days how fast companies are changing, it really
Yeah.
helps to get that staggered experience
Yeah.
back in. Yeah.
Yeah, definitely. And then just another thing on mental health that I think isn't spoken about a lot is that postpartum anxiety and mental health doesn't just stop at 1 year old or 1 year post birth. For some people, they may get misdiagnosed or it may not be spoken about. A lot of women will not speak about their experience or will not seek help. So they will still be suffering potentially when they're returning to work. And it actually might be kind of something at work that then triggers them to need to get support. So it's about understanding that even people that are returning to work, even if they kind of present well and feel well, it might be that actually a few months in, they do start to experience postnatal depression or anxiety, or even postnatal OCD is kind of could happen. And it's also about understanding that kind of there can be traumatic birth and PTSD following a birth experience, which also can kind of potentially increase anxiety for people coming back to work because people thinking, how was your time off? How was your parental leave? How was it?
I
And
know, but
actually, it can be really horrible to relive potentially or talk about, and or you feel guilt for saying it was really hard, it was really tough, I really struggled. So there's so many kind of factors that might kind of increase that anxiety. So it's just having that awareness of what might be going on for someone and what they might not be willing to share or wanting to share, but still can be happening in the background. Um, Massive one is always sleep deprivation. Like we've spoken about, it's very common. Not all parents will be sleep deprived, but a lot of them will be. But it has an impact, like especially long-term sleep deprivation has an impact on kind of your physical health, mental health, and also then your like cognitive working as well. And then also the statistic I think is really quite high is that 86% of overnight wakings are often exclusively handled by the mothers, particularly that happens in kind of exclusively breastfed babies. There will be mothers that are returning that are exclusively breastfeeding still. So if that is always down to them, then that can have knock-on effects and even things like brain fog. One thing that's also kind of touching on kind of the breastfeeding side of things is that if people are transitioning away from breastfeeding or reducing their breastfeeding to be able to return to work or things like that, there is such a large hormonal shift when that happens. Some people even describe it as like a bigger shift than kind of that post-birth one. And it can have such an impact on emotions, like kind of physical well-being, again that cognitive load. So I think it's again that understanding that if someone is returning having been exclusively breastfeeding their baby, that shift can be really quite significant and quite unnerving for the person going through it. So again, just understanding what someone might be going through in order to return to work. And it's also about understanding, is there somewhere appropriate for them to be able to pump if they need to, or can they, in order to get home for the night feed so that the baby, they can do bedtime. So it's that flexible working that also allows for them to still continue to breastfeed if they want to. Some people don't want to. Some people use it as like, okay, this is my timeline. I'm more than happy to carry on, but they use that transition to work in order to cut it down. Whereas for some people, they want to carry on for as long as they want to, and work shouldn't be a barrier for them to be able to. So it's how can we allow them to do those things and that flexibility whilst also still being able to kind of do their
yeah,
job.
it's quite sad
Yeah,
that stat 19% working mothers report receiving pressure
yeah,
from the stuff
yeah,
thing.
yeah,
And we know as well that, under the Sex Discrimination in the Equality Act from an HR perspective, presenting someone from expressing at work can constitute, a risk in that sense,
yeah,
which I always think, that shouldn't be the reason why you're supporting someone. You should just do it because it's the right
yeah,
thing to do.
yeah,
And so how important, Sophie, is it to have like maybe a proper breastfeeding expressing policy, or maybe more information as to where someone can express?
yeah,
I've heard people say that they were giving the ping pong room, right? And then they
yeah,
go to express, and then people want to
yeah,
play ping pong. So then, they end
yeah,
up leaving. So,
yeah.
I- I- what can people do in terms of having a good policy in place? What
I
makes
think
the
I
difference?
think bringing up that conversation before someone asks for it, I think that's the most important so that they don't feel, no one wants to feel like a burden. Nobody wants to feel like they're asking for more things. So I think highlighting it and kind of recognizing that if you are still breastfeeding, if you need to pump, this is what we have in place. These are the kind of, you will be protected. You're not going to be kind of questioned on it. If you've got a blocker in your calendar in order to do so, then that will be protected time as well. I think it's just being open to that conversation of what they might need. Have you got a fridge? Have you got somewhere they can actually store it? Have they got to bring a cool bag in with them with ice blocks and then worry about getting it home and it still being
Yeah.
usable? So there's so many kind of things that go into kind of pumping. It's not just as simple as having somewhere to do it.
Absolutely. I actually was going to go beyond and talk about the physiological impact, right? So you're
Yeah,
pumping, that means you can also have things like mastitis, or your child may have tongue tie. So that also goes into those, realities of parenthood that is happening in the
yeah.
background.
Yeah. And it's also about like breastfeeding is supply and demand. So if you don't pump, if you don't feed, then the body kind of triggers as a response to not kind of produce breast milk. So if someone's kind of supply drops because of not having access as well, then that can lead to kind of potentially like things like blocked ducts, mastitis, if the kind of the emptying isn't happening of the breast. So I think there's lots of different reasons as to why it's important, but I think it's just them feeling that they have a safe place and not having the anxiety of, am I going to have to go into a toilet and do it? And people are going to be in the stall next to me and hear the kind of breast pump going, because we all know that sound if we've used one. So I think yeah, opening up that conversation before someone has to ask, because they may not feel comfortable. They may just feel they have to hide away and do it if they don't feel comfortable.
Yeah. I guess the
Um,
takeaway of this slide is the hidden keyword, right?
yeah,
So what
yeah,
parents might be going through that someone
yeah.
might not be
Yeah,
aware of or realize, and how can they be more attuned to what may be going on behind the scenes? Okay.
yeah, 100%. And there can be so many different things and not everything will be covered, because there's obviously like physical recovery for some people. If they're going back to work, say after 3 months, they may not have kind of fully physically healed. But I think I saw a statistic that kind of from a hormonal and kind of recovery, it can take most people 2 years in order to recover from kind of pregnancy and birth. And if there's any long-term effects from the birth, healing around scars from cesarean, or kind of any injuries to bladders, bowels, things like that. There can be that long-term potential kind of transition that may need kind of acknowledgement from kind of a flexible working side of things as well, if some
Yeah.
symptoms need to be managed from home as well.
I
So
mean, if we're being realistic, people will have one of those things. I think it's very rare to have nothing and just
yeah,
be able to go back to work and,
yeah, yeah,
bounce back, as they say,
yeah,
and just like
yeah,
return
yeah,
it. It's
yeah.
just not realistic,
No.
to think that way.
And physical care in the postnatal period kind of in the NHS stops around 6 to 8 weeks. So like as a kind of birthing person, you don't have any, say, physical follow-up post that point. But so many things can happen past 8 weeks and kind of symptoms may not kind of come up. So it's about, have they got kind of things in place that kind of they can access kind of that care for the physical side effects, for the physical symptoms in kind of that
And
postnatal
and
period.
here we're only talking about the care for the parent,
Yeah,
but obviously
yeah,
there's also the care for the newborn,
yeah,
which
yeah, yeah,
compounds in
yeah,
equations and mental load, and having to solve for all the phases that are constantly changing, and
yeah,
that, I guess, adds to all these statistics
yeah,
as
yeah,
well. So what's
absolutely.
happening with the infant, essentially.
Yeah, yeah, absolutely. I think the only other kind of hidden reality that I would say from my personal experience is about the whole default parent. So Eve, like me and my partner, very quite equal within our kind of caregiving of our little one. He does drop-offs, pickups, things like that. He is named as the main person on nursery, but I'm always the first one called still as the mother, even though he is the first one listed. So, and I think even that is because his work allows for him to be contactable easy. I think even that, even when there are things in place, the mothers are often still the default parent and the ones expected to take the time off to kind of when this. So I think that is a massive hidden one, that even if you put things in place to kind of not that not be the case, um, it's
Yeah.
just that
I
understanding.
think, I mean, just to add to that, but I know we spent quite a some time
Yeah,
on this already,
sorry.
but so, I do also feel that there's a lot of pressures for parents, or maybe who want to help, like dads who are sharing the load, or the second partner, who feel that they can't because it's not mirrored within their organization. And so that is also a hidden reality of being a parent, is like, what culture are they coming back to, and are other people leading by example, doing pickups? Oh, that means I can do it as well.
Yeah,
That goes for both parents. So I think it's really about the culture, which we'll get to on the next slide. So shall we go there?
yeah,
Okay, super. So here are a few things in terms of practical steps that we recommend in terms of launching an inclusive benefit for parents and support. And the first one, because we've said a lot around the manager, I really have seen organizations that maybe have not had the best culture, but someone has had an amazing manager. And so that has made the whole difference to them, and vice versa. Cultures that are quite positive, but a manager that's quite tricky and lacking empathy, is making a return to work quite difficult. So really, you want to create a framework where you're eliminating this manager lottery and equipping the leaders with specific toolkits and guides. Because from an HR perspective, I think there's been a lot of managers survey on this, and most managers feel that they don't have the adequate training or they don't really know how to approach a conversation for supporting returning parents. So, you know, you don't need to be a legal or financial expert. You just need to know what your organization, you just need to listen actually, as to what the person is asking for, or, ask open question as to how you may help them in that transition period, signpost them maybe, or maybe just signpost them to HR or the people team. And sometimes it's just as easy as listening, have empathy, and go from there. Would you agree, Sophie?
Yeah, yeah, definitely. I think it's about being seen and like that you don't have to have everything perfect, but feeling listened to and feeling acknowledged and being treated as an individual. I think that everything you've said
Yeah.
is so, so important. Yeah.
And it changes, right? What you might need in the first few
Mhm.
months of returning to work might be very different than
Yeah.
what you might need in the, year of returning to work. So
Yeah.
having that genuine conversation, agreeing, what does success look like now in the
Yeah.
role, and for the individual, and discussing workload hours, discussing any boundaries that may have changed during the absence. And as I said, keeping that conversation alive, is very important. So on the second point, flexible working, again, we've talked a lot about flexible working. I don't know if I'm personally, I think it should be a default operational framework, right? To help parents to, perform to the best of their abilities. I don't think it's a favor. I don't think it's, making amendments. I just think it's giving someone the best support they need to then be productive, to then stay in the business, to then
Mm.
achieve the business objectives. But that is one that gets talked about a lot, and unfortunately, is people are very inflexible about flexible working. What do you see when you speak to people, Sophie?
I see a lot of like reluctance for asking. So, like you mentioned earlier on
Mm.
about kind of not feeling that they can request it, not feeling that they can ask for it, or kind of having the thought of, oh, my role couldn't be done within flexible hours. I've been told before it couldn't be. And I always just encourage people to just have the conversation and like even about like trial periods and kind of reviewing as you go. And I think it's a massive anxiety thing for people about kind of again that their time with their child if it allows them to have that time and again um if it also then allows them to perform to kind of like the best of their ability when they are working if they have those flexible hours that then the payoff is incredible rather than them
Yeah.
having hours that don't allow them to perform kind of to their highest standard.
Yeah.
I think as well, it's also about flexible working for all parents, not just the one returning from kind of parental
Yeah.
leave. Is like, is your flexible working policy open to every parent rather than just kind of mother?
Actually, every employee, in my
Yeah,
opinion, because
yeah. No, I
you want
agree as
parents
well.
to be
Yeah,
seen as like this other category that are. I feel like
yeah,
the amendments you make for usually all minority groups tend to help the entire organization, and so that is usually like the
yeah,
recommendation. And I think what's interesting about flexible working is that sometimes when you're a parent, it's like the micro shifting flexibility that makes a huge difference. Sometimes you don't need like the 8 hour flexibility. You just
no,
need that flexibility to do
yeah,
pickup or drop off,
yeah,
or
yeah,
do
yeah,
very specific, and then you will work, work up the time lost. And I
yeah,
think that, is very, very important.
yeah,
Um,
definitely.
Third one is language and policy. We've touched a bit on that. If you have a policy around returning to work or breastfeeding, what framework do you have in place in terms of the language, making sure you're including partners, making sure you're cognizant of all modern forms of families today, and just as well keeping that policy living and breathing and changing with your organization, with your changing in demographic, changing in workforce, and always adding to that. A really important one, especially around, the loneliness aspect that we said, or like the sharing or feeling part of something, is kind of the community side of things, which I think gets missed out a lot. I don't know, sometimes people have employee resource groups around parents, or, you're aware of there's a Slack group called Parents, whatever that might be, or a Teams group. I think it's such a small practical thing to do, but it makes such a big difference, and can be set up without budget in a few minutes. And then in terms of the support, that can have different shapes and forms. It can link back to all the benefits that a company might have. It might be financial support. Every company is different in that way, and so it's good to signpost and have that information. And last but not least, which we've said a lot, and I think sometimes that's what makes people almost not want to start, because they think, oh, well, I have to think about every single person because everyone's going to be individual. But that's what you do with managing people, right? Like you understand, what are the variables that are going to make them happy, perform to their best level. And so it's the same here. What does someone need? Just be open-minded, ask questions, and see how you can help. Is there anything you'd like to add here?
No, I think you've covered it all. I think yeah, the individual experience is so important, but also like that sense of community is just having someone to relate to talk to kind of just kind of offload any thoughts and just someone saying, yeah, I felt the same. And if they're kind of a few years kind of on from you,
Yeah,
just knowing that you're like, okay,
it will.
this will change. It's not going to be like this forever. Like there is, and also just getting kind of tips on what worked for that person on, oh, how did you manage this? How did you navigate that? I think that community aspect, and like you say, it's something that could be potentially set up quite
Yeah.
very
I mean,
simply.
sometimes just someone saying, actually, you're doing great,
Yeah,
actually
yeah,
doing a
yeah,
really good job. I
yeah,
think that's super helpful.
yeah,
I'm just
100%.
conscious of time. I think we're
Yeah,
just too passionate about this
I
topic. We said we'll
know.
do 30, 40 minutes. It's been 43 minutes. So let's go to the next slide.
Yeah.
Oh, the next slide is the Q&A. Okay, fine. Well, I wanted to discuss before the Q&A, kind of, the conversation with the employee in terms of how to stage that. Because as we said, the return to work moment is too late to like start the communication, the relationship, the awareness, the education, the tools. So, we see it really as like before leaving, let the employee know what's available to them. Maybe they have access to maternity services like Fertifa or other. Let them know how many kid days they have. Do they want to be contacted when they're away or not? Keeping that door open, and having clear expectations and confidence about returning as well, but not pressure. I think that's super important. And then while they're away, reminding them that they have access to several things, being cognizant that they're still an employee and don't have, don't miss them out, because, they still are ambitious. They still want things for their lives. They're not just a parent. And then the really important bit is the reintegration when they return. I actually really like having a buddy system for parents who return, because as I said previously, and we know from working with enterprise companies, smaller companies, even if it's like a very small company, things change so much. You might be using a new tool, a new system, you have new faces, you might have moved office. It's so helpful to have that person, maybe that's not on your team, that's helping you reintegrate and understand everything here, and being very clear about the expectations of the role and what they need in terms of the support. Okay, so if you actually move to the next slide, perfect. So I'm going to leave that here. And this is essentially some QR codes around events that we have coming up. In case you're interested, you can download our HR handbook, you can contact the team. But I wanted to open it to the Q&A in case anyone had any questions right now. We're happy. I will answer my own question, which I said at the beginning of the webinar, and it was around, what can you track in terms of the metrics? And something that you could track is, for example, the percentage of parents leaving within the 12 months of returning. How does that compare with the wider population? Looking at your attrition level, does it vary by gender, by function, by manager? How quickly do returning parents receive, meaningful projects? That's harder to track. You have to be very intentional about that. Promotion and pay outcomes, obviously, that's easier to track in terms of parental leave. Which managers and teams have the strongest retention? So this is going back to the manager, and having kind of an open feedback conversation to understand, what's working in the business in terms of the parenthood penalty in what's not working. Um, I'm just keeping an eye on the Q&A. We don't have any questions at the moment, so I'm wondering if we have answered everything. Oh, I just saw this beautiful comment, never been so seen or validated. So thank you so much. Maybe we'll end there. Sophie, thank you so much for joining me on behalf of Fertifa to discuss this topic that's close to our heart. Hopefully, you have had some takeaways from this and some practical actions in terms of how you can support people at your own work, how you can support yourself. And we wish you all the best, actually.
We've got one
Yeah, we
one
got we
question.
got one question that said we already offer a standard EAP and private medical insurance. Why are returning parents still experiencing high level of burnout? That's a really good question. I think in terms of the EAP and the PMI, it's important that first of all the employee knows about it and knows what to access. But I think on the second level, and this is why I guess companies like Fertifa exist, is that sometimes they don't go deep enough in terms of the level of support that is needed. So, for example, you might have a PMI that says you can only have 4 mental well-being sessions. You have to have a specific thing you want to talk about, and it can only be virtual. It can be quite restrictive. So that's definitely something we're happy to talk offline about, or generally give more information on. But that's a really good question. All right. Well, thank you everyone again, and hopefully see you soon for another webinar with Fertifa. Have a great day. Bye bye.
Everyone, bye.